Welcome. My name is David Fry. I'm the department chair for the respiratory care department at Temple College. Thank you for your time and your interest in the healthcare career or respiratory care. So hopefully the purpose of this information session will be to really encourage you and let you know this is what you want to do, or give you enough information you can decide, no, this really isn't for me, before you start wasting a lot of your time and money. This is exercise we started several years ago where we do multidisciplinary simulations. So in this simulation, the ladies on the left with the white coats, they are internal medicine doctor students from Texas A&M that are rotating through Baylor Scott and White. And the others are some of the nurses from next door, the nursing students here at Temple College, and the respiratory therapist. This is something, like I said, we started several years ago, and it really helps the people learn to work together, come together as a team, and work on each other's strengths and weaknesses. We also do several of these per year. We also go over to UMHB in Belton and Mary Hardin Baylor. They have a simulation center and a nursing program as well, and we do multidisciplinary simulations over there with them and the internal medicine physicians as well. So it's been a real good exercise. I think it's been very educational. So what the heck do respiratory therapists do? So here's kind of a little scenario. At 9:32, Lori brought a newborn baby struggling to breathe back to life. That's something that we do every day in the field of respiratory care. So what have you accomplished today? So this is, again, just kind of an idea of some of the things that we deal with on an everyday, daily basis. And breathing is one of those things most people just take for granted. Until you can't breathe, then all of a sudden it's priority one. We can go quite a while without food, not very long without water, and about 4 minutes without oxygen, and you start to have some brain damage. So again, it is a very rewarding field. So respiratory therapists are health professionals, and we take care of patients with heart and or lung problems. That is our specialty. We work with all ages, from newborn to 100 plus years old, every part of the hospital, from the ICU to the ER to the floor, over in the clinic. We're kind of everywhere, and we're like nursing. We're the other healthcare field that is bedside 24/7. So just FYI, going into this as a newbie, you'll probably have to start out on night shift. And yes, hospitals are open 24/7, so you're going to have to work some holidays as well. Just kind of up front let you know about that. So again, respiratory therapy, we have a very in-depth knowledge of cardiopulmonary anatomy and physiology because that's kind of our bread and butter. We also do patient assessment. We go in, we'll interview the patient, we'll do diagnostic tests, we'll do therapeutic tests, we'll work with a physician on different procedures. We are trained in advanced life support and critical care. We have a pharmacology component of it because we do administer medications. And it's kind of almost biomedical engineering and technology because we have so many different pieces of equipment. That's one of the things that attracted me to the field years ago, was just all the different equipment, and that's always changing as new technology develops. So from that standpoint, that was always real interesting for me to do. But we also assess the patient. We have a lot of therapist-driven protocols based upon our assessment. We can do, certain things, reassess the patient. Do we need to be more aggressive? Do we need to back off? Do we need to consult the physician because the patient's condition is deteriorating? We also educate the patients. We'll educate the patient's family. A lot of families go home not just with home oxygen, but there are a lot of home ventilators, home BiPAPs out there spread throughout the country. So some of the places we work, the vast majority of therapist jobs are in acute care hospitals. That's where most people start their career. After you get some experience, you may want to change a pace, do something different. Then there's diagnostic laboratories, rehabilitation, long-term care facilities. You can work for a home health company where you go out into a patient's home, educate them, train them on use of their equipment, go out and check it periodically to make sure they're upkeeping the equipment, they're using it safely, etc. Patient transport services. I know Baylor Scott and White has a pediatric neonatal transport team. The head of that department is actually a former student, a respiratory therapist. And they, with a nurse, they'll go by helicopter or by ambulance all over the state, picking up neonatal and pediatric patients that need a more acute care setting, and they'll bring them back to the hospital here. There's also respiratory therapists that work in physician office. I know Scott and White just created a position a couple of years ago. They've since expanded it. Now they have two therapists working over with the pulmonary doctors, and they're like COPD navigators and educators. So they see patients like physicians over in the clinic and assess them, make sure they're doing all their equipment correct, etc. Educational institutions as well. I personally graduated from the Temple College program in 90, I don't know, 91, 92, long time ago. So I went through the program here. Worked with Scott and White for about 25 years, and I've been teaching at Temple College. This will be my 13th year. So after all those 12-hour shifts, my feet and knees couldn't take it anymore. So I kind of went into education just as a change of pace, something different. And there's also a lot of jobs in the industry out there as far as the different manufacturers to go out and do in-services, demonstrations, sales of all the equipment that we have in the field. One of the other things that we have is pulmonary function studies. This is something done in the clinic. It's done by respiratory therapists, and they'll put patients inside basically a big plastic box, and they'll have them do breathing exercises, and then we'll get a bunch of numbers and some flow volume loops that will help diagnose the patients. Do they have asthma? Do they have COPD? Do they have emphysema? And also they can scale it on the severity of the disease process. So that's kind of a monitoring thing to test and or diagnose different obstructive lung disease processes. Some of the other things we do EKGs, we do cardiac stress testing. So we'll put people on treadmills, on bicycles, have them exercise, get their heart rate up, see how they perform. We also do EKGs on patients. So a lot of different avenues your career could take other than the acute care setting in the intensive care unit. Also, they do a lot of bronchoscopy assisting both in the clinic and also at the bedside in the intensive care unit. And that's something the physician does. He can do a diagnostic or a therapeutic bronchoscopy, either one. And anytime they're doing a bronchoscopy, we're there to assist them. We either with sedation of the patient, pushing meds down through the bronchoscope, suctioning through the bronchoscope, or putting different tools down the bronchoscope, either to remove a foreign object. They have lasers that they can put down there to excise tissue. So a lot of different instruments can go down bronchoscope. Also, there's polysomnography, which is sleep study. There's a lot of respiratory therapists that work in the sleep lab. See the poor guy in the picture here. He's got all those electrodes on his head, his chest, his abdomen, those bands around him. Okay, now just go in there and relax, go to sleep. Be easier said than done. That guy's wired for sound. But that is another opportunity for employment, another place that there are respiratory therapists. And all the places that I've mentioned thus far in the PowerPoint presentation, during the course of the program, we will rotate through each and every one of those because we're all different, what we like, what we think we like, what we may end up liking at the end. So you're going to have a little bit of knowledge about all of these areas. Obviously, a lot more about ventilator management and hospital because that's where the majority of the jobs are and that's where most people start. But we will rotate during the course of the program through all of these different facilities where you will be exposed to that because that may be something that really fascinates you and may be something that you decide you want to go into. There's also hyperbaric oxygen chambers. We rotate through there, so they put these patients in basically 100% oxygen, and they'll dive down to about 2 atmospheres, and they'll stay there for a couple hours. Most of the treatments done in this area are for diabetics who have wounds that will not heal. So when they get in that high pressure with 100% oxygen, it revascularizes their foot, and they end up saving a whole lot of feet that would otherwise have to be amputated off of these diabetic patients. There are a lot of other things they do in hyperbaric medicine, but that's kind of the main focus of it for the most part in this area. So what do respiratory therapists have to do? Well, one, we have to be able to critically think. We have to be able to rapidly assess the patient, assess the environment, and figure out a treatment plan for that patient. And that's one of the hardest things is to learn how to critically think. It's a different type of learning than most of us are used to. You may have a history class that goes over the Revolutionary War. The next semester you take a history class that's from the Great Depression on. There's not a whole lot that you have to remember about the Revolutionary War that's appropriate for post-Depression America. All our classes are comprehensive and they build upon everything from the beginning. So all those assessment skills that we go over the first, second semester, you have to not just memorize it for the test, you have to actually put it to long-term memory because it's something as a therapist that you will be doing each and every day on the job. It'll help you develop and implement effective care plans for your patient, etc. As far as job outlook for the field, this is from 2018 from the BLS, the Bureau of Labor Statistics. There's a 21% increase in the next 10 years for the need for respiratory therapists. So there should be a lot of jobs out there. Good economy, bad economy, doesn't really matter. People get sick 24/7 and they need someone to take care of them. So what do respiratory therapists make? This is a national average. Again, it's a couple years old. So the median pay is a little over 60,000 a year. It is entry level, is an associate's degree. At this point, you can get a bachelor's degree in respiratory care. You can also get a master's degree in respiratory care. Not much difference between an associate's and a bachelor's degree in pay. And at this time, there is no difference in what you can do as a RRT. You both take the same test, whether you have a 2-year degree or a 4-year degree, and what you can do with that license is exactly the same. Now, I always encourage students to always get more education, but I think it's a better choice to do the 2-year first because you're making money 2 years earlier. And a lot of the hospitals have a tuition forgiveness program or tuition reimbursement. So you can start work after 2 years, go ahead and get your bachelor's degree, let someone else pay for it. So I think that's a better option. We have affiliation agreements with Texas State in Round Rock, and we also have one with Midwestern in Waxahachie. So you can go straight from our program to working and transfer all the coursework you do toward a bachelor's degree at those two programs. So this is the average in specific. I know it was 60,000 was the median average. This is for Central Texas. This is what they pay at the big hospital in this area is 53,000 to 44,000, and that's for new graduates. That's when you walk out the door. That's what you can expect to make right now. The 44,000 is for day shift. The 53 is for night shift. So you make quite a bit more money working the night shift. And again, that's starting pay. So here's a picture of one of the simulation rooms we have at Temple College. Currently, we have 8 of these simulation rooms. So the mannequins are pretty realistic as far as they'll have breath sounds. You can palpate a pulse. You can make them breathe. I can control how fast they breathe, give them different breath sounds, etc. There are several cameras in the room, so everything can be recorded. We can play it back later, see where we did good, see where we did bad. And we do a lot of simulation in here. And we don't always utilize the mannequin. Sometimes we'll put a real patient in the bed. One of your instructors may be the patient, or we may put one of your co-students in the bed, and you have to do whatever procedure on a real patient, which makes it a lot more realistic than the mannequin. Great, but there are limitations. This is just a picture from the control room where you can control the mannequin as far as breath sounds, heart rate, respiratory rate, vitals. You can palpate a pulse on him in several different places. And again, as I mentioned earlier, everything in there can be recorded and played back later for a debriefing on how the scenario went. Here's a simulation that we did. These are all 3 RT students. This is probably about 10 years ago. You can see we obviously the patient coded because we're doing chest compressions. They've just been put on a ventilator, which is what the young lady is squeezing with her left hand. And the guy in the background is setting up a ventilator in the event that the 2 in the front doing CPR are successful. Then they can go ahead and place that patient on a ventilator and do mechanical ventilation. One of the other things that I mentioned earlier, these are both former students again as well, but it's one thing to put a BiPAP on a mannequin, but it's another to put it on a real person. But you also will not only put it on a real person, I'll have each and every one of you wear the BiPAP. That way you'll be better able to describe what it feels like, what the patient will be experiencing, and ultimately hopefully give you a much better understanding of wearing a BiPAP and what it's like so you can communicate that to your patient. This is a meme one of the students did several years ago when one of our other instructors was talking about BiPAP and drawing it on the board, and it got a little confusing looking. So she made a little meme and had to send it out to her classmates. One of the other things everybody knows, nurses do IVs. That in the last couple of years has kind of fallen into our scope of practice as well, where we're starting to do IV access as well. But what we've always done is arterial blood gases. Nurses typically don't draw from an artery, they draw from a vein. That's something you can see. When you draw from an artery, you can't see it. That is something you have to palpate. Where you feel your pulse in your wrist, that's where we're drawing the blood from. And with that arterial blood we get, it's called an ABG or arterial blood gas. With that, we can get the pH, we can get the CO2, and we can get the oxygen level. And with that information, we can manage the life support, the ventilator, the BiPAP, whatever device that we have the patient on at the time. In our sim room with our mannequins, we have 3 or 4 mannequin arms that I can give a pulse to, and you can draw blood from the arm to practice doing ABGs. After we get somewhat competent with that and our skills are good, then we generally bring in the sophomore class and the other instructors. That way we have direct adult supervision, and we'll draw arterial blood gases on each other. So again, not only have you drawn one before you go talk to the patient, you've also had an arterial blood gas drawn on you. So you've got the feel of it, and you hopefully won't be near as nervous when you go in the hospital and draw an ABG for the first time, because it's not your first time. You've already done this in the lab. Some of the other things we do, everybody's heard of CPR, which is BLS, basic life support. That is something you have to get before we start clinicals. You will do that on your own. There are 3 additional CPR courses. There's NRP, which we were doing in this picture, which is neonatal resuscitation. We'll do that during the course of the program, and that's hospital CPR for newborn babies, where you have drugs, you have electricity, you have a ventilator, and it's kind of an advanced life support for the neonatal. There's also one for pediatrics, and there's one for the adult care, which again is hospital CPR with blood, uh, electricity, drugs, etc. So we'll do all 3 of those during the course of the program, and that helps make you more marketable once you get out of the program. This is one of our 2 classrooms. All our coursework are done either in this as a classroom, the other one is a classroom, but it's kind of a laboratory as well, because we have 50 psi oxygen in the wall, we have air in the wall, we have suction, and we can hook up all of our equipment and play with it and get some good hands-on. This one is more for a lecture classroom. Looks like I'm talking about going over chest x-rays with a group of students. Some of the other things we do in simulation, we have a student here, he's intubating the patient, which is he's putting a tube down their trachea into their lungs that we can hook up the ventilator or life support to and sustain life as we know it. Here he's using a glide scope, and you see the little TV camera kind of in the background. That's a picture of the vocal cords, so you can get direct visualization of the tube passing through the cords rather than have to put your face right on top of the mannequin and do it. There's just another joint simulation we did with our nursing next door. Obviously, the patient is coded as we're doing chest compressions. The guy at the head of the bed has an ambu bag, and he's bagging the patient, which would be putting air in and out of the patient's lungs. So they're probably getting ready in the background to intubate him or put the tube into the lungs and hook up a ventilator. This is something the students voluntarily started doing a couple of years ago. A lot of people have the inability to cough, whether it's because they're weak, their nutritional status is down. They just don't have the physical strength to do it. They could be dehydrated. Their secretions are really, really thick. Well, sometimes we'll have to nasal tracheal suction a patient to get the secretion out of their lungs, and that's where we'll take a tube, we'll insert it down their nose into their throat and into their trachea, and we'll get secretions out. I had a class a couple years ago. They all wanted to do it, so I'm like, okay, let's do it. Sign the waiver, and I gave them pediatric catheters. I didn't let them use the full-on size adult catheters. I took a little mercy on them. But here is a demonstration of some of the things we'll do in the lab.
This one? This side? Okay. And what we talked about, use your catheter. There you go. Come in at an angle.
Okay, breathe in. Breathe in. Breathe in. If it hurts, let me know. Breathe in.
Go, and you're in. Okay, there you go. You would suction. Now come out. There you go. Good job.
Oh, God.
Come out quick. You can come out quick.
All right, so how do you apply if I haven't scared you off by this point? So our application deadline is June 17th. The application procedure, all subject to change with the COVID going on. Right now you need to take the TSI, the Texas Assess Initiative, all 3 parts. Also, you need to take the TEAS 5 exam. Right now our testing center is closed. They're looking at doing some online testing where there's a video of you being monitored by another person where you can do these. Right now, if we admit people, it may be tentatively admitted upon successful completion of these exams. On the TEAS test, we need a 62 or higher. Also, we need official transcripts from any institutions of higher education that you've been to. We need 2 letters of reference. Email is fine with all the COVID going on. You can just email them to us. Not from a family member, can be from a former instructor, a former boss, could be from your pastor. I don't care, just not a family member. Also, you need a physical and medical clearance attached to this web page. There's the application process. There's the paperwork that you'll need to fill out. You can either send it back by email, download it and print a copy, and then mail it back to us. It doesn't matter, but you do need to get physical clearance from your physician to make sure you are healthy enough to do the job. Obviously, if you have a weakened immune system, you probably don't need to be in a hospital working. That's not going to be a good career for you. And then we do an interview process just where we can all sit down with all 3 instructors. You can ask us questions about the profession, about the program, then we'll ask you some questions. Why do you want to do this? Standard interview type questions, just to make sure it's going to be a good fit for you in the program. So the prerequisites, these are the things you have to take prior to admission in the program. You need to take your English 1, Composition 1, A&P, which is Human Anatomy and Physiology 2401, and then you take an elective from a social or behavioral science. So there would be a SOC or psych class. So if you have those 3 prerequisites, you'll be good to go into the next class. Other non-respiratory things you have to take along the way, you have to knock out Human Anatomy and Physiology 2 or Biology 2402, a single fine arts or humanities, and that's a broad range. It could be humanities, history, literature, religion, philosophy, music, art, drama. Basically, it's an elective. I always strongly encourage you to knock out your elective and your A&P2 prior to getting in the course, because it serves 2 purposes. One, if it comes down to a numbers crunch, if you have more than the minimum requirements, you will get a higher score than a student that just has the minimum requirements. So when it comes to selection process, you would be more likely to get in because you have above and beyond what's needed. The other reason is if you've had an A&P class, they're pretty daggum tough. Our courses are somewhat on that level. So rather than having 4 hard courses the first semester, you will only have 3 hard courses. So that'll make life easier for you in the long run as well. One of the things that you'll have to do is a preclinical background check and a preclinical drug screening. So if you come into the program, this will be the January after you start. So you'll start in August. There are no clinicals the first semester. It's all classroom on Monday and Wednesday. Tuesdays and Thursdays you have off, or you can do your A&P too if you have not already done so. Second semester, when we come back in January, same format. We have class on Monday, Wednesday. Tuesday and Thursday, we start clinicals. Generally, we hold you back till about mid-February, and we do a lot of simulations in the sim room on Tuesdays and Thursdays. But when we come back in January, that's when I'll give you the information for the background check and for the drug screening. Typically, that's about $75 cost to do that. And also in the information packet that's attached on the website, there's a 7-year list or of convictions. If you've ever been convicted of anything, any of these things in the last 7 years, you're not going to pass a background check. The hospitals aren't going to allow you to come into their facility, and this is not going to work for you. And then there's another list of, if you've ever been convicted of any of these offenses, you need not apply, because you're not going to be able to go to the hospital. And if you can't do that, you can't graduate. So check those out before you apply. Here's a list of some of the different educational sites we go to. We go to pretty much all the Baylor Scott and White facilities here in Temple. We can go down to Seton, to Dale Children's. We do Seton Harker Heights Medical Center. We do St. David's in Georgetown. We no longer do St. David in Round Rock. We can go to Seton Williamson. We do Metroplex or Advent Hospital in Killeen, and we do the hyperbaric oxygen that Scott and White has in Temple. And we also go over to Coryell County to Gatesville to their hospital over there, so you get a rural hospital experience as well. So credentialing, that's just talking about when you graduate. So you can get a temporary permit 30 days before you graduate. That's about $57. That will speed you up, because you have to have 3 things in order to go to work as a respiratory therapist. 1, you have to graduate. 2, you have to pass your credentialing boards, and 3, you have to have a license from the state of Texas, which we get from the Texas Medical Board, who moves very, very slow. So it's a good $57 spent to go ahead and get in their system. That way, as soon as you get your credential from the NBRC, you can go ahead and start work. Organizations, there's the AARC, which is the American Association of Respiratory Care. That's kind of our national organization. There's also the Texas State Society for Respiratory Care, the TSRC, and then we have the ARCS, which is the ARCS, which is Association of Respiratory Care Students. So we have several different organizations. We try to participate in the TSRC every year for that convention. We go to the AARC every 8 to 10 years, depending on how often it comes back to Texas. Since it's nationally, it gets a little expensive to go to that one, depending on the location. Your credential that you get is a national credential, so it's good anywhere in the country. Your license, though, is state specific, but you'll qualify for a license in any state. You'll just have to send them probably a background check and some paperwork and a couple of bucks for it. So once you graduate, you're eligible to take the exam from the NBRC, which is the National Respiratory Care Board. Your test is 160 questions. 140 of them you are graded on, so there's 20 test questions throughout. So you can pass this test at 2 levels. If you pass at the low cut, you are CRT, which is a certified respiratory therapist, which is a thing of the past. Most hospitals won't even hire you if you're a CRT. They won't even take your application. So your goal is to be an RRT, a registered respiratory therapist. If you pass this test at the high rate, then you're CRT registry eligible, which means you can take the next test. The second test is clinical simulations. It's done on a computer, and you'll have 22 scenarios, of which 20 are graded. So those 22 scenarios are little patient scenarios. So they may say you're working a 500-bed hospital on night shift. You get called to the ER to evaluate Mr. Smith, who was in a car wreck. and then you'll have 15 or 20 things to pick as far as assessment. What's his heart rate? What's his respiratory rate? What's his saturation? What does his chest x-ray look like? Is he awake? Is he alert? Etc. Based on the information you gather, then the next section you have to make a decision. Okay, what do we need to do for this particular patient? So you'll have 3 or 4 information gathering sessions in a scenario, and then 3 or 4 decisions that you have to make. So once you pass that, then you are a registered respiratory therapist, and that's what most hospitals in the area want at this time. Accreditation, we are accredited respiratory care program through COARC. You can go to their website, which is listed here. If you click on problematic outcomes, it'll print out or display a PDF file, which is almost too little to read even with my cheaters on, but that will let you compare every respiratory care program in the country. So it's listed by state. If you scroll down to the T's, you can see Texas, and then you can find Temple College. Our rates are very, very good. We've got 2 awards the last 2 years, should get it again this year, and it's for a 3-year average of above 90% of our graduates obtaining the RRT examination. So that's a pretty nice award that we've been getting the last few years. So respiratory therapists can make a difference. It is a rewarding career. It's very challenging, but it can be very rewarding. I thank you for your time. If I can do it, pretty much anybody can do it if they put their mind to it. Here's my contact information, David Fry. Email is the best because, well, we're on the COVID, so we're not really in the office anymore. Our office secretary and the glue that holds this all together is Debbie Pardon. Any of the information you fill out, you can send back to her, and she will start a file as a prospective student. And she's the one that keeps track of that, so you can email her any questions as well. And a couple of years from now, we can have you. This is our class of 2019 that just graduated from Temple College. So thank you for your time. If you have any questions, please feel free to contact me or contact Debbie, and we'll answer anything the best that we can. Thank you. Be safe.